Confirms the province is in a sixth wave of COVID-19, but at this point is not concerned that it will be overwhelming.
We have our 3-point plan. Continue to wear a mask, continue to get vaccinated, ensure that you keep up to date with your boosters, and know if you would be eligible after discussing it with your healthcare provider for antivirals.
So antiviral treatment like Paxlovid will be available at pharmacies for older people and those with other health concerns. Now, Ontario is not bringing back the mask mandate, but Dr. Moore encourages people to wear them in indoor public settings. Let's go to Colin Furness, infection control epidemiologist. Thanks for your time tonight, Colin.
Sure, thanks.
Did you want to see a mask mandate brought back?
I did. Not only that, but on an emergency basis, and not only that, to have N95 masks issued, given that the spread we're seeing in schools right now, it's well beyond concerning. And I really thought that's what we were going to get. But the problem is that decision was a political one, not a public health one. It's election season, and the governing party has dug in its heels. It's campaigning on no masks in schools. That's their platform, and that's not going to change, I guess.
So Dr. Moore's talking about people wearing masks in an advisory kind of way, meaning he's advising people to wear a mask as opposed to saying you have to wear a mask. He's also talking about people wearing a mask for 5 days after they've been through COVID and have isolated for 5-day periods. Have you seen when you are out that people are choosing to wear masks, or what are you seeing sort of in your daily sort of out and about?
Well, I'm fortunate at the University of Toronto, we still have mandatory masks. So in my work environment, that's what I'm facing, and I'm very happy for it, and I hope it continues. What I hear about schools is that it varies. There will be a mask or an anti-mask culture that takes root in the school, and it can be the principal and some teachers or some parents, and so it varies widely. You know, the two schools my kids attend are pretty well masked, and I don't know why, because there are so many schools that aren't, and I hear that from teachers, and I hear it from parents. I hear teachers telling me in confidence that they know that kids are being sent with Tylenol with an active COVID infection to school because the kids are saying so. So we've got a real mess of attitudes around, well, let's just let everyone get it and just be done with it, because that's what they're telegraphing. They're not saying everyone must get infected with COVID, but that is the outcome. That's clearly it. When they're saying, well, we'll keep the ICUs open and just maybe wear a mask. That's a way of saying, get infected, you're going to get infected, just deal with that. And I don't accept that. I don't accept that at all.
Yeah, before we used that line of too many people are in the ICU, too many people are in the hospital, and that's what we want to watch, and we never want to get to the point of pushing that limit. Dr. Moore seems to be okay with where we are now.
Yeah, I think he's using the wrong yardstick. I mean, it's easy to say there's not a lot of people in the ICU. Okay, well, we know they're lagging indicators, and we've done this in prior waves, done nothing until the ICUs are full, and by then the damage is done. The whole point is to do interventions so that we don't get to that point. So he's using a lagging indicator to say there's no problem, and that makes no sense at all. The other thing is, it's not just ICUs. Long COVID, brain damage, vascular damage, you can suffer a lot of these things. You can have a life-altering harm and never see the inside of a hospital. It's only in the respiratory phase when you can't breathe that people go to hospital. But brain injury can happen without you even really being aware of it. That's not uncommon. So the whole population health piece is missing. He's not saying we've got to keep people from getting brain damage. He's saying we need to keep ICUs open. Wrong yardstick. I want population health to be the yardstick. I want us to own up to the harm that COVID does. I want us to admit it's airborne. And I want masks back in schools and other places until this wave is done.
We're going to have now something like Paxlovid available at pharmacies. Do you think that will be helpful?
Well, you need a diagnosis in order to get that, and it's hard to get testing, and they say they'll accept rats, except that you need to get Paxlovid in the first 5 days, and a lot of people will not test positive in those first 5 days, and especially if they're vaccinated, and so that's a problem, right? So there's just less access to PCR tests. That's a big problem. The other thing is Paxlovid costs $670 for a course of treatment as opposed to $10 for a vaccine, and we're prioritizing people who are not vaccinated, I think, for that drug treatment. That doesn't make really good economic sense. And you know what? It's a pretty intense drug. It's got drug interactions. It's not safe for everybody to use. It's not just like popping an aspirin and feeling good the next day. And so I think the idea that let's hang our hat on that now, that's not a way to manage this. I'm glad we have the tool, but it's not a cure-all for everybody.
Colin Furness, I got to leave the conversation there, but sir, thanks for your time tonight. I appreciate that.
Yeah, my pleasure. Thanks.